How long does it take? This is a screen capture from the FDA website. The FDA has this information on their website explaining the 510K process. Is this reality? No. Most of the 510Ks are not issued in 90 days, and I almost never see any mention of this 100-day, we were unable to make a decision, explain why. The average is over 120 days, and for certain products, like a lot of the IVD products, it's closer to 180 days. So how long do you tell a client it takes? Well, I said in one of my other videos, we tell you what you don't want to hear. It's going to take you like 120 days or longer to get your 510K. There are going to be delays. There are going to be questions. There are going to be problems. You may have to do additional testing. We'll prepare you for that and try to minimize the risk, but we're not going to tell you what you want to hear. Oh yeah, you'll get your 510K in less than 90 days because we really know what we're doing. That's not the case. Yes, Mary has had a good run of multiple submissions that were issued in less than 90 days. And I've had some that were issued in less than 90 days. But we also have had submissions that were not accepted the first time and got a non-substantial equivalence letter, and we had to redo testing. And we caution the clients, this may not work. We may have to do this additional testing. They try anyway. They fail. We help them with the testing. We resubmit. Now we get the 510K for them. So we actually help companies that didn't succeed the first time get their 510K. So not everything works as planned. So how long does it take? It takes 120 plus days. And we can tell you, because we've done the analysis for different device classification, we can tell you for this device classification, this is the average. Here's the problems with the companies that have taken longer. Here's what we've seen. Most of the times it's because you didn't do some testing you need to do and you have to redo that testing. So a lot of our focus in the planning is trying to make sure you have the right tests identified so you don't have to repeat any testing, and certainly don't want to pay for any testing twice. So how long does it take to develop a device? Well, that's a different question. Let's say your 510K takes you 90 plus days, more likely 4 months, 120 days. Well, that's this phase here. How long does it take to prepare your 510K? I say 100 days, not because it takes us 100 days to write the 510K. It only takes us a week or less, but because it takes 100 days for you to do the testing during this verification and validation stage, and we're typically putting together the 510K in parallel with the testing during that 12-week process. So this is 12 weeks, and this is probably more like 16 weeks. So you've got a 3-month period here and probably a 4-month period here. And back here, you've got a pre-sub process. A lot of companies want their pre-sub to happen overnight. Well, it takes 60 to 75 days to set up a meeting with the FDA. And we've had a lot of success getting it really close to that 60-day mark, but you need to ask for that pre-sub when you're first developing your design inputs back here, not when your design is completed back here. Otherwise, it'll delay all your testing. And as I said before, you're really looking to try to minimize any delays caused by you didn't identify all the right testing. And part of that is doing your risk management activities. So I show, here's the risk management activities you're supposed to be doing, and here's the design process. Here's when you're doing a pre-sub, here's when you're doing your testing for verification and validation, and this is the FDA review. And this whole process, 9 months minimum. Because it takes a long time. This is 2 months. This probably be another month before you start your testing, another 3 months here, another 4 months here. I'm already over 9 months. So even if you compress this and try to hedge your bets and take some risks, you're still looking at a 9-month process minimum. And it's not uncommon to see more than a year for development of a medical device.